Good day everyone, I am Jeka Javier and I will going to perform the cranial nerve assessment. For the assessment, first, assess for doctor's order, client's level of consciousness and level of knowledge and understanding, the availability and functionality of the needed materials. Also, we have to assess the mental status or ability to participate in the procedure. Next, for the planning, if possible, determine whether screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipment, and timing. Next, prepare the equipments, the percussion hammer, which is optional, whisk of cotton to assess light touch sensation, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, quinine flavors, percussion such as tuning fork, tongue depressor, paper clip, pen light, and clean gloves. For the implementation, first introduce yourself and verify the client's identity. Explain to the client what you are going to do, why is it necessary, and how the client can cooperate. Second, perform hand hygiene and observe other appropriate infection control procedures. And third, provide for client privacy. Fourth, inquire if the client has any history of the following, such as the presence of pain in the head, back, or extremities, as well as the onset and aggravating and alleviating factors, disorientation to time, place, or person, speech disorders, any history of loss of consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory or mood swings, problems with smell, vision, taste, touch, or hearing. And after that, for the cranial nerves, we have the cranial nerve 1, olfactory. Ask the client to close their eyes and identify different mild aromas such as coffee and vanilla. For the cranial nerve 2, optic, ask the client to read Snellen's chart, check visual fields by confrontation. For the cranial nerve 3, we have the PERRLA or the pupil reaction. For the cranial nerve 4 and 6, the trochlear, assess the 6 ocular movements. And for the cranial nerve 5, the trigeminal, while the client looks upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. To test light sensation, have the client close their eyes and wipe a wisp of cotton over the client's forehead and paranasal sinuses. To test deep sensation, use alternating blunt and sharp ends of the safety pin over the same area. For the cranial nerve 7, facial, ask the client to smile, raise the eyebrows, frown, puff out cheeks, and close eyes tightly. Ask the client to identify various tastes placed on the tip and sides of the tongue, such as sugar, salt, and identify areas of taste. For the cranial nerve 8, auditory, assess the client's ability to hear the spoken word and the vibrations of a tuning fork. For the cranial nerve 9, glossopharyngeal, apply taste on the posterior tongue for identification. Ask the client to move their tongue from side to side and up and down. For the cranial nerve 10, vagus, assessed with cranial nerve 9. Assess the client's speech for hoarseness. And then for the cranial nerve 11, accessory, ask the client to shrug shoulders against resistance from your hands and turn head to side against resistance from your hand. Then repeat for the other side. And then for the cranial nerve 12, the last, we have hypoglossal. Ask the client to protrude tongue at midline, then move it from side to side. Then for the evaluation, evaluate the patient's response to the procedure, document the procedure and other important data on the client's chart. Good day po! I will be your student nurse for today and I will be performing cranial nerve assessment.